Student Hotspotting is a program designed to pair interprofessional groups of students together, and they work with patients who have high utilization of the healthcare system. So people who go to the ER a lot, who go to the hospital a lot. And the idea is that these people have a lot of complex medical issues, but they also have a lot of complex social issues. So the teams work together, they bring their professional lenses, and they determine what's driving each patient's utilization, what can we do to help them and set goals and to improve their lives so that utilization comes down. So the Hotspotting program is a 6-month intervention where the students get assigned a patient, they get together as a team, and then they have regular meetings with the patient. They get a chance to learn about them. It's all really centered in developing authentic healing relationships. A lot of these people have not had positive experiences with the healthcare system, and so this is their chance to really have an advocate, to have a coach. And so the program really invites students to dig deep into patients' lives and to help make a difference for the healthcare system.
My favorite part about Hotspotting, I think, was learning more about the roles of other health professionals. So being able to work with a team that included a pharmacy student and social work and nurse practitioners, I was able to learn so much about the skills that those professions can bring to the table. It's great being on a team because you don't have to do everything alone. You can bring your knowledge, but then also know that there's other people there to kind of back you up and help you out. And so learning to kind of lean into that was a really useful thing I learned. I think one thing that Hotspotting does really well is it shows these patients that there's people out there who care about them and are willing to put in work to help them make their lives better. I think the most impactful thing for me with Hotspotting was seeing the patient begin to feel empowered in managing his own healthcare again. As students, we were capable of helping him do that.
The Hotspotting program was valuable to my career because it allowed me to get out of the classroom, interact with other individuals, interact with patients, and utilize a different part of my brain to figure out what I could do as part of this team and really help with the care of the patient, even if it's something that isn't directly medication related, but still made an impact in the patient's life. If you want a challenge, it's a great place to challenge yourself, challenge your thinking, and really move forward with your education and hopefully gain an experience that will last you a lifetime.
So the unique thing about Student Hotspotting is, from an interprofessional education standpoint, it's real. These are real patients, they have real concerns and problems that they're trying to work on, and it gives them an opportunity to do something that makes a meaningful difference. Not only are they learning, but they're contributing to healthcare generally. And I think the students really appreciate that. They appreciate that what they do makes a difference, both for the patient and for the system. Most of our interprofessional education experiences are simulation. So when you compare a real-life patient encounter and a longitudinal encounter to a simulation, there's just tremendous value. So there's a movement in interprofessional education to go away from just educational experiences into changing practice. And so Hotspotting really sits at kind of the confluence of those two ideas. Is we're training, but we're also influencing practitioners. And we definitely see it as a way to improve not only the education we're providing for students, but what's happening in our clinics and our hospitals as well.
The Hotspotting program was really nice to do because I can use it for my practice, and I can even use it right now, even as a student. The skills that they taught us and the experience of seeing a patient who really was a real patient and really struggling helped me realize that it's totally applicable. What you learn in Hotspotting, you can use as a student and in your future practice.
All students are welcome in Student Hotspotting. I don't think it has much to do with what year you are, what profession you come from, but where really your heart is and what you're passionate about. So students who love to work in teams, who love to learn more about other professions and want to make a difference for patients and for systems would be excellent Hotspotting students.